everyone. I was just wondering, do the COVID-19 and the Candid Auris infection is one and the same? I want you to evaluate it and let me know. I want to introduce you to Mrs. Stephanie, 64 years old from Chicago. Actually, she have traveled long distance and just came to attend one of her beloved marriage. When she was in the marriage sessions, suddenly she was collapsed, and due to that she was admitted into the hospital. There the investigations was going on. Her condition was deteriorating day by day with fever, high grade fever, weakness, and she was completely got bedridden. Everyone was so worried to know about her, as she was very good enough with her health. Suddenly how she is deteriorating. When the investigations have done, the doctors was not able to evaluate what is the exact problem of the patient, because she was not at all having diabetes, hypertension. So what may be the problem that she is continuously deteriorating? Lastly, soon after the culture results arrived, with that they have evaluated that patient is affected with Candid Auris organism. But however, no one was able to save Mrs. Stephanie. It's so sad. Lastly, after her death, when the cultures of her bed, equipments and supplies have done, it was very shocking to know that the organism Candid Auris was even present at the roof of the patient's room. Oh my god, it's so shocking, right? So as a healthcare provider, when we are going to deal with many of the organism infections in the healthcare settings, we have to know about this all. So today we will be discussing on Candid Auris organism infection, how to prevent this. These are my objectives. Try to listen till the end, but because at the end I will be asking a question to you. So please answer that, like, comment and also subscribe my channel. Thank you. Candid Auris is a multi-drug resistant pathogen that has been associated with infection and outbreaks in healthcare setting in several countries. A high percentage of clinical Candid Auris strains demonstrated resistance to fluconazole and shown variable resistance to other antifungal belongings to three major classes: azoles, polines, echinocandins, therefore limiting treatment option. Is it so curious to know, when the organism is completely getting resistant to major antifungal medications, how it can be treated, right? So since the organism was first reported in Japan 2009, cases have been increasingly documented worldwide, making the organism an emerging global threat. One of the most common problem to manage Candid Auris infection is to identify the organism in routine laboratory, which require specialized laboratory methods. Like other organisms associated with nosocomial infections, it can be transmitted among the patients and from contaminated environment, giving the importance of effective infection prevention and control practices. This is the statistical presentation how the cases was getting spreaded all over the world, through which all sides of the patient body we can recover the Candid Auris organism, such as from the blood catheter tip, skin ear discharges, urogenital tract discharges, and also swabbing can be collected from the respiratory tract or the respiratory tract secretions. Clinically, Candid Auris organism capable of causing serious invasive fungal infections such as candidemia, pericarditis, osteomyelitis, pneumonia, urinary tract infection. Upon this, there are various, but these are the common clinical manifestations. Diagnostic investigations can be done to evaluate the Candid Auris: specimen selections, specimen collection, specimen processing, antifungal susceptibility testing for Candid Auris, reporting the confirmed cases of Candid Auris, and immediately the actions should be taken, precautionary measures also to be taken in order to prevent the infections. To the preventive measures, how we as a healthcare provider can prevent the infection in the healthcare setting is first of all notification, which is very important. Whenever a patient with a certain infection gets admitted, all the healthcare workers must be notified. Then infection control measures, everyone should be well aware about these personal protective equipments, how to wear it, when to wear, and how to discard after the use of the personal protective equipments. Monitoring and management of the potentially exposed staff who are taking care of the infected patients, as well as the other patients who are getting exposed to the infected patients, should be taken into the consideration. Whereas decolonization protocol for 5 days, especially with the help of antiseptic and the used linens to be bleached, quarantine the patient as well as the staff who are exposed to the infection. Environmental cleaning plays a vital role, as the Candid Auris infection can get easily spread from one room to another, one healthcare worker to the another patients, or through the environmental cleaning plays a vital role in preventing the infection in the healthcare setting. All the equipments and supplies used to the patient must be get cleaned with the help of bleach equipments. Complete room of the patient must be cleaned with the antiseptics, and also the beds, linens, IV stand, cardiac table, and lastly it should be there must be a culture done to detect whether any of the organisms pathogens present in the surrounding of the patient. This is a robotic machine which every hospital needed when they are having any infected patients, so it helps in observing all the microorganisms and pathogens in it and kills it. So this is how the sterilization of the infected patient's room will be done in the healthcare setting. Hopefully the video may be beneficial to you. If you really like the video, please like, comment and subscribe. Here is today's question of my video. If you know the answer, please leave your answer in the comment box. Thank you so much for being till over here and to listen to my entire video with a lot of patience.